Hey everyone, Julien here, nurse practitioner for Dan Aesthetics Medical, and today we're continuing our series on neuromodulators, and today we're going to be focusing on how we can use neuromodulators in mesotherapy for the areas of face, neck, and décolleté. I think you guys are going to love this. Let's get right into it.
You better stop moving.
Before we jump into it, this video is talking about botulism toxin. So whenever I'm saying Botox, Botox is just an abbreviation for botulism toxin. So let's get into talking more about Botox. So what is Mesotox and how did we get here? Well, let's bring it back to its foundation, which is standard Botox. When you're doing standard Botox treatments, you're taking a very concentrated amount of product and you're placing it deep into the muscle. And therefore, the whole idea is to tell that muscle not to contract. Because the muscle isn't contracting, your skin isn't folding, and therefore the lines that are there iron themselves out. That is essentially, in a nutshell, what Botox treatments usually are meant for. Now, if you ask anyone who's had regular Botox treatments over the years, has it helped your skin? Every single one of them, guarantee, is going to tell you a big absolute yes. The reason why is because there are additional benefits to Botox other than just helping the wrinkles. What it's doing is helping shrink pore size, right? So people usually will have larger pores for multiple reasons. Genetics is one. You can have, let's say clogged pores. You can have a lot of sebum production. You can have acne scarring, active acne. These are all contributing factors to people who have large pores. Whenever you're doing Botox, basically what it's doing is it's reducing the amount of sebum that's being produced. So if you have suffered or are suffering from active acne, that's going to take care of it. Also, the acetylcholine receptors are also hit at where you sweat, your sweat glands. So your sweat's going to be reduced. So therefore, you're still going to have a nice glow, but you're not going to look as oily, and also your skin's going to look better. And the reason why people who are getting standard Botox treatments are seeing an improvement of their skin is because the Botox actually does improve the skin. And also a reduction a lot of time for clients with rosacea and melasma. So let's clarify that a little bit more. So Mesotox is all about getting the skin quality benefits from neuromodulators without having any muscle activity involvement whatsoever. And the way to do that is by placing all of the product into the dermis. Only the dermis. Actually, meso is Greek for middle, so you're placing it in between the epidermis and subcutaneous tissue, and the only way that it can stay there and not migrate or hit any other muscle activity around it is by hyperdiluting the dose. You only place a very, very minute amount to give the skin the adequate dosing required without hitting any other tissues. So heads up, this is an advanced skill. Every time that you do this injection technique, you must see a raised bleb. That means you're in the dermis. If you do not, that means you went too deep and the product probably reached the muscle, which means that they're going to have an asymmetry in their face. So you definitely want to go to a skilled provider, or you want to be a skilled provider before offering this technique. Now, if someone comes in and they've never had neuromodulators done, then you can do the entire face, and I would recommend not doing anywhere around the eye or around the mouth, because it's going to screw up the way that they can open up their eyes, and it's going to potentially mess with their speech, and they're not going to like that. Now, if someone's had neuromodulators, and let's say they've done the upper face with their standard dosing for the glabella, wrinkles, the forehead, and the crow's, then they're getting the full benefit of the microtox anyways with their strong dose, so you don't really have to do this part of the face. What you can do is just do the lower aspect of the face, and really what I concentrate is around the cheek and lower aspect of the jawline. So this entire area right here, that's where I'm going to coat with this mesotherapy. I'm going to do 30 to 50 pokes per side. I'm in the dermis every single time, and I'm using a 4-to-1 dilution, which means 4 units of saline with 1 unit of toxin, and I'm going to do Mesotox therapy all throughout. Each injection point is probably going to take about 2.5 to 3 units of product of my mixed dilution, and that's how I'm going to do the entire face. Be very careful when doing that. You don't want to go too deep, otherwise you're going to cause some issues. Now, looking at the neck, you can approach that in one of two ways. You can strictly treat the bands, right? So these horizontal necklace lines that cause the tech neck thing, you can place little blebs superficially, just like the face, all throughout the lines, and that can soften them as well. It doesn't do a great job, but it can improve them by about 20%. Or if you're looking at the overall texture, turgor, pore size reduction, and just kind of like a nice glistening of the skin, then what you can do is you can do these little superficial blebs all throughout the neck, and you can do that similarly to the face. And again, now you're going to look at probably another 30 to 50 injection points per side because it's a pretty big surface area. And you want to dilute that down again, 4:1 dilution, and that's going to prevent them from having any swallowing issues. Now, when I'm looking at the décolleté, I treat this almost as a combination of your Mesotox mixed with your standard Botox dosing. And the reason why is because you're going to have an impact on the skin, but you're also going to have an impact on those lines that form in between the chest and the décolleté, usually from breast or from sleeping on their side or from exercise, sun damage, whatever that's happened that caused those vertical lines, this neuromodulator can help improve that. But I am going to usually need a higher dose in order to get the full response. So what I do is I just take my standard dose for up here whenever I'm looking at contracting the muscles. I take the same 1:1 standard dilution that I usually use, but I place it intradermally just as I would my Mesotox. And I'm going to do 50 units here, which means, again, 50 injections, and I do a triangle pattern, and I go all the way down in between, and I'm just going to place my product there, and it's going to work wonders. So it helps with sweat decrease, it helps with overactive sebum production, it helps just make their skin look better, and it definitely softens those lines. Be mindful though, when it comes to the neck and décolleté, people either love it right away, but it might take 2 or 3 treatments in order to really see the big benefit in the long term. And if they can stay the course, they are going to continue doing this forever. So the question that I had, and you might have as well, is how long does this Mesotox actually last for if you're using it in a hyperdiluted state, right? Well, you can't compare it to regular Botox. Regular Botox dosing is all about how long is it going to make that muscle relax for, where I'm not hitting the muscle at all. I'm just focusing on the skin improvements. And the best way to answer this is that initially, when it's your first time doing it, you're going to notice an improvement after about 2 weeks, and it's going to probably last 6 to 8 weeks. But the more you do it, the more longevity you're going to have out of it, because it's having a bigger impact on the skin, and at the molecular matrix of the skin, it will continue to work even after the medication is gone. And your skin is going to look much better in the long term with repeated use of this microtox compared to never using it at all. Now, there are studies out there that support that microtox can also alleviate or diminish the appearance of rosacea and melasma. Now, in my personal opinion, I haven't noticed that, but I haven't continued on the long-term journey with microtox with these clients. But I have a feeling that people who are going to be getting the benefits of this are people who are going to be doing this in a long-term fashion. I think it's going to be very similar to doing Mesotox the first time. You might notice an improvement for maybe a couple months, but with repeated uses, you're definitely going to notice months of improvement afterwards. So if you enjoyed this video, make sure you check out my Patreon. It's where I do live injections on real clients, and it's designed for serious medical aesthetics providers just like you. So until the next video, take care of yourselves, exercise daily, and please be nice to absolutely everyone. Cheers!